Welcome to this month's Fit for Colorado Talk to the Doc Chat. I'm CBS 4 anchor and health reporter Kathy Walsh. For the next half hour, we'll be chatting about fitness and health issues here on CBS4Denver.com. Throughout this chat, we encourage you to ask questions by simply typing them in the chat window at right, and we'll do our best to answer those questions. In today's chat, we're going to discuss indigestion, what it is and how we can prevent it or treat it. It's also called dyspepsia. Indigestion is what we often call an upset stomach. It's a term used to describe a feeling of fullness or discomfort during or after a meal. It can be accompanied by a burning or pain in the upper stomach. The symptoms can often include bloating, belching and gas, nausea and vomiting, acidic taste, growling stomach, burning in the stomach or upper abdomen, abdominal pain. These symptoms may increase in times of stress. People often have heartburn, the regurgitation of gastric acid, along with indigestion. Joining me today is Dr. Reginald Bell, a surgeon at Swedish Medical Center who specializes in gastrointestinal surgery, and Rachel Lindstrom, a study manager with the University of Colorado Denver Center for Human Nutrition. Okay, Dr. Bell, indigestion, something we can all relate to, I think. How common is it?
It's very common. Actually, probably a quarter of adults suffer from it on a monthly basis, and maybe even 10–15% get it weekly. There are probably 5% of the population has it regularly enough that they need prescription medication on an ongoing basis for it. So it's a very common problem.
And it can be really troubling. Let's talk a little bit about things that can cause it. First of all, my understanding is some diseases. Let's take a look. I have a list here. Ulcers, off the top. We've heard ulcers can definitely cause it. GERD, which is gastroesophageal reflux disease, also known as acid reflux disease. Same thing as heartburn oftentimes, excess stomach acid coming back into the esophagus. Stomach infections can cause it, and IBS, irritable bowel syndrome. Rachel, you want to tackle that one? What is that?
What is IBS? Well, irritable bowel syndrome can be considered kind of a catch-all. It's often for people who they fall into this category if they experience whether it's nausea or diarrhea or constipation on a very regular basis. In fact, there are 3 different types of IBS. Type C, which is constipation, D, diarrheal, and then there's a 3rd type, which is sort of alternating between the 2.
Yeah, these are things people don't like to talk about, but I think things that so many of us, as Dr. Bell said, experience. Medications also, my understanding, can cause a lot of this problem. So let's take a look at the list of medications. Aspirin and other painkillers can cause indigestion. Estrogen and oral contraceptives, not one you would think of. Steroids, if you've ever had to take steroids, you know, why is my stomach upset? Certain antibiotics, same thing. They say make sure you take it with food and fluids, that kind of thing, and thyroid medications. And then also lifestyle. I think this is the one that a lot of people really have to examine in their lives. Eating too much, too fast, and foods too high in fat. Too much alcohol, cigarette smoking, stress, and fatigue. Would you agree that all those things, whether it be one or a combination of those, can cause the problem of indigestion?
Oh, absolutely. Absolutely, and I think we're seeing it more and more commonly, partly because as a country we're getting heavier. And there's a very clear correlation between weight loss and resolution of many of these symptoms. So one of the first things to look at is not only lifestyle in terms of what you're eating, but how heavy you are, and what you can do to modify your diet to help not only eat more healthily and in terms of aggravating factors, but also to lose weight, which will decrease these symptoms also.
So if you lose weight, you can stop the problem?
Many people do. Absolutely.
And Rachel, what do you tell people? I mean, I know that it's nutrition, 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 but people don't want to think that. They want to have a pill that takes care of a problem.
Right. But the nice part is you can do just small changes for a healthy lifestyle. We encourage people to walk a few more steps a day. If they can get 2,000 steps more per day, that can add up and lead to weight loss. Eating a few less calories a day, using a smaller plate instead of a larger plate, and making sure that you put the food on your plate in the kitchen and then bring it to the table and eat it, so that you have to think more about, am I full now? Do I really need to get up and walk over and get more food instead of just bringing it to the table and having it there?
A lot of times it's behavior modification, it seems, is it?
I think so.
Yeah. You know, most people don't realize if you eat 30 calories more a day, which is a couple of teaspoons of sugar, more than your body needs, in 30 years you'll gain 100 pounds.
Huh.
If you have a cookie a day, 100 calories a day, in 10 years you'll gain 100 pounds. So it's a very fine balance, and most of the time our body auto-regulates that. But in a society where we're presented with a huge portion when we go out for lunch, we think, oh, that's okay to eat. And so I think the first things are absolutely some behavioral modification to help moderate our dietary intake.
You have to learn to say no when they say supersize it, huh?
Yes.
Mm-hmm. Yeah, absolutely. Does it mean cutting out certain things entirely?
I don't think so. I think cutting out things entirely sets people up to overdo it the next time it's in front of them. So just really being careful to be in moderation. And a lot of people need support. They can't just, they have the intention of living a healthier lifestyle, but they need a little bit extra support from either friends or family. And that's something, America on the Move actually just launched a new website with an online health-oriented community so that people can interact who are all trying to live healthier lifestyles, get feedback, get recipes. Everyone can log their steps and see that they're walking more and eating a little less and eating more fruits and vegetables, things like that.
Yeah.
There are, for people that have indigestion, there are certainly some things that lifestyle modification will help decrease that amount or diet modification will help decreasing the amount of chocolate, red wine, spicy foods, and most people kind of figure this out on their own. But those things are known to increase sensitivity of the esophagus to reflux, or to actually loosen up the valve at the lower end of the stomach, so that people are more prone to get reflux and acid heartburn.
Chocolate? It just doesn't seem fair.
It's not fair. Chocolate and red wine are
Oh, my
two of the
goodness.
worst. So.